What do you two think we could do better as residency programs to improve our education with the LGBTQ community? What suggestions do y'all have?
So I am a first year, and I did have a pretty robust, relatively, compared to you guys here, LGBTQ healthcare within my medical schooling. So when I was applying, finding a residency that offered me the chance to work alongside a gender clinic was actually high on the rank list. So just having one here was a big way to show, just make it more visible, increase visibility. That's what I was going for. I think that was a big one on the medical side of it. Other things as a system that we could do to increase visibility is, right now it's hard for me to say because I haven't been here for a year quite yet. I haven't been here during the month of June, but I would hope to see some kind of increased visibility, not only on the campus itself, but around the city itself.
Okay. Makes sense.
That does. I think that's something, because I know at least in June of last year, we would, the login website, I think they would mention, it's Pride Month, or there was at least some mention about it, which was more than I was expecting, so that was good. I 100% agree. Just the visibility is so important. Letting people know that we are here and that we are a resource for all of their needs. And even, having attendings that we get to work with, such as the both of you that are willing to even have these sort of discussions or, work with residents in these type of these issues. I think it's really cool.
Well, that's good. So those are some things that we can keep in mind and, try to increase going forward as more attendants get more comfortable. And then, of course, as the system continues to show its support, I think those opportunities will continue to increase. I did want to touch on ensuring language and communication is inclusive and respectful. I think we briefly touched on it when we talked about pronouns. Along that vein, anything else that you think that we should be aware of?
So I know it's hard being in the South. I'm a Northerner, so these words don't come out of my mouth. But I know if you're born and raised here in the South, these words come out of your mouth all the time. Yes, ma'am. Yes, sir. That to a transgender person is not a good thing to say. I would recommend saying thank you or, some other phrase. Me coming from the North, my phrase is always, hey, you guys, what's up? And I've changed that. Now I'm Southern. I say, hey, y'all, what's up? So there's simple phrases like that. I know it doesn't sound like much, but simple things like that can make a huge difference.
I would agree. I'm from Nebraska, and a lot of my patients say, yes, sir. And the first week I was here, I was caught off guard. I'm like, I'm a child. Not a sir quite yet. But also in that regard, I think understanding that if you're not used to adjusting your pronouns, it's not something you should just glance by. You should take that moment, apologize, and then correct it and move on. I think that is one of the best ways to show that you're trying, you're cognizant, and you are willing to put in the minimal amount to work when it comes to working with trans people.
And when I have trans patients that I'm working with, if I have questions, I usually just go ahead and ask. And I found for the most part, they really enjoy educating people and just to see that you're even interested. So for example, I was kind of going over some of my thoughts about diagnoses, and I was reading kind of like my opening statement, and I kept saying, transgender male. And then they told me, you could just say trans mask. And I was like, oh, really? I didn't know that. And they're like, yeah, you can totally say that. And it's much shorter. And I was like, ooh, thank goodness. Okay. Yes, but I think, like you were saying, as long as they see that you're trying and making an effort, that's really all anyone cares about.
Yeah. And then in Epic, it's got in parentheses, their name, the preferred name. So I recommend using the preferred name. You don't want to use the name that's on the insurance card because that's what they call dead naming. So you don't want to dead name someone. Right. You want to use the name in the parentheses.
Yeah, I think we were talking earlier in this year about trans-safe restrooms and how there's a pretty well-known website where it's commonly used where they can feel safe to use the restroom. I know that our clinic is listed on that website. So say if they're traveling or they're away from their house, like you said, a lot of them have had PTSD or like past experiences where they won't use the restroom in other places, but knowing those resources exist is always good.
You had mentioned the bathroom, and I don't think people realize how important it is for our transgender folks to feel safe to go to the bathroom. They'll come in and they'll have constipation, they'll have an impaction because they are not using the bathroom. They'll come in with urinary tract infections because they're afraid to use the bathroom. So that's a good point. We do need to have gender-friendly bathrooms.
I'm particular about my bathroom, and it's not even for gender reasons, so I can only imagine.
Give me a little bit of information. What are your thoughts about detransitioning?
Yeah, there's a lot of speaking points and people going around about detransitioning. Detransitioning is actually less than 1% of the transgender population will actually detransition. The reason they detransition is they don't have the support. They don't have the social support. They don't have the support at work. They don't have the support at home. But that's the number one reason for detransitioning. They're not being accepted for who they truly are. So then they detransition, and then we're back over here with Dr. Otey in the mental health arena because that's not good. Anything to add on that?
That just breaks my heart.
Yeah. Anything, Dr. Sayaloune?
Yeah, I would agree. It's statistically and just living a part of society, detransitioning is not common at all. Less than 1% of the people who actually do transition. Unfortunately, with the way social media works and the way things can echo and be microphoned from one person to another, it seems like it is a bigger issue than it actually is. I always like to reframe it to people of transitioning is not an overnight process. As you said earlier, we do regular checkups. We discuss goals of transitioning throughout every visit, seeing if they're happy with it, if they don't want something to happen, they do want something to happen where they feel comfortable. And then to get to the point where you transitioned and then you want to detransition, I think support, like you said, is the one area that we see them lacking in. For many of them, they had support when they denied their gender identity, and they felt that they needed to transition just for their own mental health. And then they get to a point where they're transitioning and they're stepping away from that first support group and they're seeking a new support group. We function as a support group as they're going through the transition, making sure they're still wanting to transition and proceed through the process. And they're getting that gender euphoria at that point, and then they get to the point where they don't have a support system. May it be other ideology they hold that prevents them from becoming a part of the queer community, or they're in a small area, or they were really close with their former support system and they don't feel like they can step away from it, so they always have that in their ear. And at that point, we see people detransitioning and trying to gain their original support group back. even though their original support group may have not been the most supportive in all aspects of their life.
Yep.
So it's something they have to make a choice of are they comfortable enough, or is the grass greener, and can they live a more full life by making that very hard decision?
Yep, it is true. It's a hard decision for them to make.
Mm-hmm. And it's one they have to wake up and make every day, unfortunately, because they step out, they open themselves up to not only overt aggression, but also the multitudes of microaggressions, such as not being able to use the restroom, getting misgendered, and just people being rude to them. So,
Yep, that is true.
There's definitely a lot of things that we need to be cognizant of. Think of the different scenarios and different issues that, unfortunately, the trans community has to navigate, sometimes without much help. But this, I think, has been very helpful to kind of shed light on some of those issues and see where we can be better individually and as a health system. So I think I want to start to wrap and just ask for your overall thoughts on this subject, and just give me a brief idea where you think, what you think is what you want to leave our audience with.
Okay. I'll start. I just wanted to let everyone know that I think this was great. I love the direction that we as a system are heading towards. I love that we have attendings like you that are working with GME. And I also wanted to just say to the trans community, we support you, we're here for you, and we just want you to feel safe and cared for.
I think it's important for the whole LGBTQ community to realize that Northeast Georgia Health System is moving in the right direction. As you said, we are training our employees on how to be more inclusive, more affirming. Wording, language is important, so we're really stressing that message with our staff. And I think moving forward, we as a system are going to do a lot better in serving the LGBTQ community.
Yeah, I would kind of echoing what you guys said. I think one of the biggest takeaways I'm going to bring home with me is that medicine is changing. Trans care years ago, or not so many years ago, was considered a specialty medicine. Now it's becoming more of a common topic that's discussed in more medical schools. And it's becoming more primary care kind of medicine at this point, as we see with Dr. Bahnmiller here. It's something that many primary care physicians should be able to take on with a little specialized training outside of medical school. Either they get it through residency or they pursue the classes afterwards, but it is going to become a overall pretty common medicine. And I think NGMC is there at the beginnings of it, understanding that it's going to become a pretty common medicine and trying to take steps to make all their patients feel more comfortable.
Great. Wonderful points by all of you. I think one of the things I definitely think about is that we do have resources. We have people we can lean on as physicians and resources for our patients and their families. And I think it's wonderful that we have young, bright people, young, bright doctors in touch with the issues and the community, and will be a great resource. And there are things that we can do, like Dr. Bahnmiller has done, to educate herself and to be a great resource. And I'm glad that the health system is on board and taking care of the entire community. And that's wonderful. And I think we're heading in the right direction and doing the things that we need to do.